that too. I had to write down because I was forgetting it. But do your clients come to you on a voluntary basis, or is it through the judicial system? And if a client, person out in the community, just had kind of heard about you and wanted that type of program, how could they go about finding it? Who would refer them? Who would know about you?
The requirement for the project we were a part of, a client had to be enrolled at a residential treatment facility administered by Behavioral Health Services. Who sent them there or how they got there, that would never made a difference. It was as long as a person was enrolled in one of these four facilities, they were then eligible for the study.
And they were substance abuse?
Yes.
Substance abuse clients enrolled in a treatment facility were screened into the CBT group. They had to go through a screening, the PHQ-9. Some of you are familiar with that. They had to go through that screening as well as other screenings to be eligible for the CBT group.
So is CBT something that's not commonly used or well known about with other facilities? Not to the extent that we facilitated it. We were a part of a research project.
Yes, ma'am.
I'd like to know if cultural or ethnic diversities affect the end result.
You know, I couldn't speak to that because of the research going on with it. I know that the books we used were pretty much culturally neutral and applicable to anyone at any time, male, female, multigender.
And there's actually a lot of data on that now, and it's very exciting. CBT has been used with in a number of studies with African Americans, with Latinos, and with a small number of studies with Asian Americans, and it has been effective across the board if done thoughtfully. So it is really effective across cultural groups, which is very exciting. Thanks for asking that question.
Has CBT been used where the client comes into the agency, or is it field-based where you guys are going into the homes of the families?
It's the project we were involved in. It was clients were enrolled in an agency.
Mostly in agencies, yeah.
So how do you think if it were field-based, it would affect the outcome of CBT or any variation of, like, with my agency, they have trauma-focused cognitive behavioral therapy. And I know the studies and the research that have been done with that is in the doctor's office, in the therapist's office, coming into the office. But in working in service area 6, where they might not have the gas or they might not have the transportation to come every week or 2 times a week to the office for an hour and a half to 2 hours, it's difficult, the skills that we're told to use from this manual, to go into Watts and Compton, avoiding certain gang-affiliated areas, going to communities where there's drug use happening, maybe even in the home. So I'm wondering how these tools are used in the field.
I can't speak to that, but it's kind of one of the reasons we're here is how do we get this more involved inside the communities. I lived in Willowbrook for years. There's a lot of churches right there, and there's King Drew Medical Center, and there's a Willowbrook school right there on the corner with empty rooms. How do we make that happen?
We've done some in the home, and it's as effective in the home if you have to find some place that people can feel confidential, that others aren't listening to them, and so I don't think the setting makes much difference as long as there's some way that you can ensure that they're open, other people aren't listening to them, and they can have some privacy to do it. I think it can be done in equally effectively, probably in a lot of settings, including homes when necessary.
Do you actually get down to their core beliefs that able to change those negative schemas within those 12 weeks that you have with them?
Well, I think we almost always can work on the beliefs that are getting them at the moment. And sometimes I think you make a difference in the big picture, like, oh, whoops, I was thinking of that wrong. And sometimes I think we may not get to the most basic. It probably depends. I I've certainly seen it happen where I thought people really started thinking about the world in a different way that was much healthier for them. Particularly maybe feeling better about themselves and who they were in the world. And other times I was, very convinced that we got over the hurdle this time, but I wasn't sure where we would go later.
So would you have a conversation then about their worldview at some point then?
I don't actually think there's great evidence to say that there are these different levels and that one makes it, just in terms of the research. So the way I think about it for everybody, we talk about how you should recognize if you start getting depressed again, and if you do, these are some things that you should do. I would kind of suggest that to everyone. And when you get people feeling better, then life takes over. So if they get themselves in a better situation, some people are not going to get depressed again. So I never, I just like to open it up for everyone to think they could get depressed again, and what should they do. And I think that conversation is always really important.
I was just going to share from my experience, working in CBT as a clinical social worker. You have a very nice program that, gives you sets of things to include. But when you've been trained with CBT, you can do a lot of what you're doing, but you can also incorporate a lot of other things. And CBT has been around for a long time. Mm-hmm. And other things, and, usually as clinicians, we're always meeting the client where the client is. And so not all clients are ready to talk about their world, view of, everything. So it's very about themselves, it's very self-focused. So it's really about meeting them where they are. Where are you? What's going on with you? How are you feeling? Let's talk about what's going on with you right now. And there's other techniques that you can also incorporate into CBT, like using an eco-map or a geogram to sort of talk about the history of family and blah, 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 in terms of depression, or just even normalizing the fact that how you're feeling is okay and you're not alone. And I think what's really great about what I'm hearing from what you're presenting today is that the group session, the CBT sessions, really help clients to understand that they're not the only ones who are going through this. Because a lot of times when people are suffering with depression, they are isolated, and sometimes they may believe, I'm the only one who's going through this, or they don't realize it's depression and something can be done about it. They just feel like this is just the way I am normally, and I will never get out of this.
Yeah, very well said. Thank you.